Our job from a pharmacy standpoint is to review emerging literature as fast as we can. And I think we saw that with COVID in that we had a vaccine within 12 months of the first patient in the United States. I mean, that's unheard of. Vaccines are 5 years in the making typically, and we had this very soon, and it's panned out, right? I mean, they're amazingly effective vaccines. We actually started that journey towards that first dose in August of 2020, when the first studies were released that was showing that the vaccine was effective against the coronavirus. Pfizer was one of the first studies.
In November, Michelle Charles, who is our Chief Nursing Informatics Officer at Parkview, called me up and said, I've got to get this clinic set up in a really short amount of time. In partnership with our simulation innovation team and our process improvement team at Parkview, we conducted a series of physical simulations of the clinic itself. And the main goal was that all the people coming to the clinic would have an excellent experience.
Our project was stood up in November, and we were the first organization in the state of Indiana to give vaccines on December the 14th. It was an amazing accomplishment. But this journey is not finished. At our organization, we've given over 160,000 vaccines. At one time, we were giving 1,400 vaccines a day. But now that number is pretty much dwindled down. We're doing 400 to 500 a day. We've moved from Miro, the mass vaccination clinic, to New Vision, which is still a mass clinic. So the way we do vaccines has really changed from doing that 1,400 vaccines a day to doing a smaller amount, giving boosters, which is very important, as well as first shots, but also doing vaccines within the community.
We were fortunate to be a part of that conversation and set up a small, makeshift pharmacy, if you will, at the Miro Center, where we had pharmacy resources available to mix the vaccine mix. So we typically had 3 or 4 pharmacy personnel on site, beginning 2 to 3 hours before the vaccine clinic opened and staying until it closed.
We developed a computerized model. The clinic leadership could use this computerized model to change the staffing levels or understand what the flow would be that day so that people coming through the clinic would have an excellent experience. And all of the materials that we created, including the computerized model, was made available through the state of Indiana to all facilities that were setting up a clinic across the state. And the Allen County Department of Health used those materials to set up their clinic actually at the Coliseum.
When I think about vaccines and what we have done, we as an organization are committed. Hopefully, we will tame the beast and it will become something that an endemic where it's just a part of us, but we function normally. So that is my goal, is that we, again, as a society, can function in a normal way.
I'm truly blessed to lead some of the smartest, kindest people I know that I've ever met. I'd put my pharmacy team up against any academic medical center, against any major health system in the country. They're brilliant, they're dedicated, and I know they're tired, and it breaks my heart that there's nothing I can do for them. But just cheer them on and tell them how much I appreciate everything they've been through and everything they've done for our community.